Hello, welcome to Top Surgery Q&A, where you had some Q's and I have some A's for you about top surgery. Let's get started. There is kind of a lot of questions that sort of have the tone of like, how did you know and how were you certain that you wanted top surgery? For me, that's a hard question to answer because I feel like what people want is to know like if they themselves like should have top surgery, and I have no idea. So I just really want to say anything that I'm talking about, anything that I'm saying, it is all coming from my own personal experience. I'll probably have very little advice in terms of like things that I think everyone should do, but I think I have a lot of advice for things that like could be helpful for some folks. Yeah, every person is different and every trans person is different and every non-binary person is different, so like I have no idea if you should get top surgery. For me, when I first had boobs when I was like probably like 14, 15ish, and then they started to like really come in, I have always had until being on testosterone incredibly dense breast tissue. And I didn't really know how to describe that, so I think I always said that I had breasts that were like muscle instead of breasts that were like fatty, if that makes sense, which it's not any kind of morality. It's like a very neutral statement of like they just were always like, I don't know, like perky. With like my boobs were always big, but I up until my like mid-20s, like it happens to so many people, I was a lot more petite and also probably had an eating disorder, and so it was very very small. Like my like rib cage to like breast measurement was like insane, so like my bra cup size has always been bananas. I've always hated wearing bras, never liked it even when I didn't hate having boobs. And then when I got to a point in my life where I was eating the amount that I was supposed to be eating and feeling good about my body in a lot of other ways, I started just like hating my boobs. And the I don't know. I also have breast cancer on like most sides of my family. I think literally in like 4 different like sides of like like grandma's, like lots of that. So I remember as a young person being like, oh, well, I'll just cut off my boobs and then I won't have to worry about it. Like I'll just do like preventative cut my boobs off surgery and then it just won't be a problem. So I would say that being like a thought that I had as a young child, it's not that I always thought I wasn't gonna have boobs. I think I just have always, if not distaste for them, have always just had kind of like a like whatever, like they're there. I've never been like stoked about having boobs. So I can't speak to that if that is an experience that you've had. A lot of folks also kind of in that vein were like, oh, like what are you most excited about once you get top surgery, like being able to do with no boobs? And for me, the experience of having breasts felt so much like when you are wearing like underwear that is too tight for you and it's just like a little bit too tight, and so you're just like going about your day and you're like, oh, I gotta like pick this wedgie and like wiggle and like figure this out, and like it's fine, it's like whatever, and you can like forget about it for a little bit, and then it just like keeps coming back and it's just like so annoying. And if for some ungodly reason you had to wear underwear that was too tight for you for, you know, like 8 years, then at a certain point for me, I was like, I'm just so done with this. Like in the past, I had been like, oh, whatever, like maybe I'll get top surgery, I'm not really sure. When Morgan and I first started dating, I was like, don't be too attached to my boobs because I'm not emotionally attached to them. And at some point, they may no longer be attached to me. And Morgan had never dated a person who was trans at the time that they were, like, knew that they were trans at the time that they were dating. If that makes sense. So yeah, I don't know. It's just kind of, it's always something that's been in the back of my mind. The thing I was most excited about not having boobs for it's just been existing and not feeling uncomfortable. My least favorite things about my boobs were like I get like migraines, and so like neck tension especially will like cause that. So like my neck and my back being sore, and knowing that part of that had to do with having so much tissue here that I didn't want to be there, feeling like my outfits weren't cute, or like I had to wear something specific that like also like binders like made my like neck and like back hurt worse, and more tense, and so I was more likely to have a migraine. Like being out and about, like running like errands, any activity where I would have to be in a binder for more than like 15 minutes was kind of like sensory hell for me. Especially if I was in a place in public where I was not able to like take it off or like do something else or like whatever. So yeah, it's just kind of changed every single aspect of my life. So it's kind of hard to be like, oh, this is the thing I was most excited for. It's like just like all of it, just like day-to-day things. So excited to not have them. I just was sick of them. I didn't like wake up one day and be like, I'm tired of having boobs and I'm going to have top surgery now. Like that wasn't what it was. It was always just kind of this sort of like building thing. It was like 4 years ago, and I was like, I am just, the only feelings I have about my breasts are either neutral or negative. Like I don't have a single positive thought about them anymore, like at all. So I may as well get started on this process. The like approval process for top surgery and getting the like paperwork in order and like all of those things, I knew that it was gonna take between like a year to like 2.5 years. There are a couple of different times where I called surgeons and was like, what's your wait list look like? And they were like, LOL, 24 months. And I was like, okay, all right, thank you. Never mind. And in retrospect, I guess I could have. I don't know. I don't know. It wasn't at that time at the top of my list of priorities. Now, it just got worse and worse and worse and worse and worse to the point where I felt like I was not going to be able to have boobs for any longer once I actually got them gone. I don't know if that's like the right choice. In a perfect world, I would have had top surgery when Morgan was like 6 months pregnant, and then we could have kind of avoided the tenseness that happened. Not tenseness, like the tension of like me being in charge of a tiny little person and not being able to pick them up. Like that was really, 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 really hard. But in terms of with him being born, that was the perfect time I could have gotten it done if I was going to have it top surgery once he was born, because it was before he was like rolling over, because he's like now starting to roll over and like try to get around. And he was a lot more, you know, we were kind of like into a groove with like sleeping and like other things and like feeding and like knowing what he was about and like not feeling super overwhelmed. I will say my top surgery recovery was significantly more difficult for me, I guess for obvious reasons, than like Morgan's C-section recovery, partially because Morgan was in the hospital for the first like two, like three, but like the first like really rough part, right? And top surgery here is an outpatient procedure. I don't regret waiting until I was 28 to have top surgery. I also, like, if I could have gotten it done earlier, I probably would have. So I wouldn't necessarily say if you're like 22 and are like, maybe I'm too young to get top surgery. I don't know if that, I just don't know your brain. And so I don't know, you know, I can't imagine that I would be disappointed to have had top surgery earlier than this. I would have been disappointed to have it later than this, but I think I would have said that probably at any point in time that I had like getting top surgery. Okay, I don't know if any of that's helpful, so sorry about that. Somebody said, I'm not going to say people's names just in case they wanted it to be anonymous, so sorry if that's annoying. What did you feel like you were least prepared for before / during / after surgery? The part I was least prepared for, I did intentionally. I didn't want to know about drains. I knew that if I looked into it too much, it would freak myself out. And I think that I made the correct decision in that. The actual like care of like drain sites and like having drains, it wasn't too bad. It was really crucial that I had Morgan, as someone who's very squeamish. But yeah, for how long I had them in, that I wasn't prepared for how hard that was going to be. And then, yeah, it felt like having a migraine in my chest and stomach for like 12 days is like the best way I can describe it. It made my attitude so bad. So bad. And I was so tired. And it was awful. Truly so awful. Also hard when, you know, we had been on a sleep schedule where Morgan and I were both getting 6 hours of sleep, like a crisp 6 hours uninterrupted of sleeping. And I just needed more than that because it was like really, really, really exhausting. Yeah, that was just hard. I don't know that, yeah, I don't know. I'll have to ask Morgan what like she would like to say about that, but I think that's sort of like the closest to being like resentful of each other that we've maybe like ever been in our marriage. And it was so awful, but like it wasn't like Google divorce lawyers awful. It was it was hard, I would say. It was hard, and I think typically when we're in a tough spot, it really feels like it is the two of us on a team against whatever's happening, and this felt not quite as much like that. And like we're okay, and it was good, and it's fine, and everything's fine now. It was a tough spot. It was really hard. Yeah, and then also the drain removal was okay actually. But yeah, to know how long the drains were, I think would have made me maybe feel worse at the time if I had known. Emptying them out was actually kind of like not that bad after I had gotten used to it. Oh God, and then also just seeing my chest for the first time. So many people were like, don't be freaked out if you have like a weird reaction at first emotionally, because that's not how things are gonna look, and also like you just had major surgery and like it's a lot of pressure to put on yourself. And so emotionally I was like, oh, maybe I'm not gonna be obsessed with how my chest looks. I wasn't prepared physically to be like, I'm literally going to faint. I don't know if it would have been better for me to know that beforehand. But yeah, it was just a very intense reaction to having had like the surgical binder that they put on you, and then to have that off, and everything just felt so weird. Which a lot of people also asked about, like, did you feel like there's a difference balance wise? I think maybe that would have been the only time, but there was too many other things going on for me to be like, yes. And it was like the balance and things being off kilter that was so weird that made me feel that way. I don't know. Probably part of it. What was more weird to me was like how tight my chest was. Like I just wanted to be like this all the time, which makes sense because, you know, there's a scan and like they take it and it's like, but yeah, they're so weird. So weird. Not horrible, but not great. So did you ever have any doubts about it? I like not significant ones. I think I always, and then, oh my God, another thing that's like kind of crucial. I am currently on OHP. So the insurance that I'm on, I always knew it was going to be completely covered, that everything about it was going to be covered. And also I work from home, here doing this with you. So I think I would have had more doubts if it was going to be like $10,000 or more than that. Yes. So no, not really. No. Yeah, there just was no part of me that was like, maybe I would like to continue to have boobs. Like I was like, no, I was so tired of it. And I think that's also like, you know, I'm 28, and so it kind of took me a long time to be like, no, like I can do drains even though I really don't want to. Like, no, I can do like 6 weeks of recovery from an elective surgery. Like that's how sure I was. So I don't know. I don't think that having doubts is uncommon or cuckoo bananas or necessarily like a reason to not have top surgery. Top surgery. I don't know. I have no idea. But yeah. A lot of questions that are kind of like, how much did you have to rely on others to help support you in physical recovery? Or sort of people being like, do you think you could have done this by yourself? Or like, at what point do you think you could have done it by yourself? I think it depends on the kind of top surgery that you're having in terms of like whether you have like drains or not. I can only speak to my own experience having had drains. And also I'm squeamish. So I think I like Morgan basically was completely in charge of my drains for probably like 5 days. Um, and then around like probably like 9 or 10 days, I was like confidently like, no, like I can take care of this. Like I can like shower and do other things and like empty my drains and like do other stuff by myself. I think that if I had been in a place where I needed to get my shit together more quickly by myself, that may have been possible. But I would definitely say the first like 3 days, would be really good to have a person with you. And also to beforehand move everything that you need to reach to like reachable height for you. If that includes like we have a shower thingy that like comes down. You guys may have seen in the video. That was like crucial, super super helpful, really good. Also, long scrubby brush was really really good. I was just having Morgan like washcloth wash my like back and butt before that, and it was, you know, like we're married, so it was a little chaotic, but yeah. Anyway, I think with mobility things, also having a bidet, I think there are things that you could do to make it you more likely to be able to care for yourself as quickly as possible. What I will say is that like there's a reason that it is not an outpatient surgery in a lot of places other than the United States. I know a lot of people were like, I can't believe they sent you home with drains if they're folks who got top surgery done in like Europe. And yeah, it wasn't pleasant. Somebody said, did you get super cold too? I got my top surgery like 3 months ago. Now when it's only chilly, my ex tits shiver. Yeah. Yeah, it's so weird. It is so weird. I'm so much colder than I used to be. I have to like put on little jackets and things. I didn't think about how much insulation was happening there. And I'm much colder. So yes. Somebody said maybe this is bananas, but did you experience phantom titty feelings? Or do you experience phantom titty feelings? I don't know. I definitely every once in a while have this weird kind of like, there's like these like sort of zappy strange things that happen because like all of these nerves, there's so much numbness here, and all of these nerves are just kind of like existing and coming back together and like trying to figure out what it's like to be a chest again. For me, I feel like I had weird like phantom like nipple sensation a little bit at the beginning, and I've always hated my nipples being having any kind of sensation applied to them at all whatsoever. So I was like, wow, it's so weird. So I would say not a lot. And I don't know if it's that versus like nerve discomfort that's happening, but yeah, a little bit weird. The other thing, not quite like phantom boob feelings. But the first time that I like scared myself by not having boobs, you guys know when you like get into bed and you're like getting comfortable and you just like hold your under boobs. I don't know why. I feel like it's a thing that people with boobs do. I like went to reach for my under boobs just because that's just like where my hands automatically went. And they weren't there, and I was like, ah, and I was like, where? And I was like, oh yeah, that was a whole thing that I did on purpose. That was wild. Somebody said how to deal with the OMG, what have I done emotions. My what have I done emotions had to do with like knowing that I was having to go through recovery, and there being a baby that I was in charge of also, and being so tired. My what have I done emotions had nothing to do with like being like, oh no, I should have boobs again. Like even when I like looked at my chest in the mirror and was like, that's not what I thought it was gonna look like, and I don't know if I like it, I was like, thank God the boobs are gone though. So yeah, I don't know. The whole time that I was so uncomfortable and had drains and was like, I'm not going to be able to do this, I just wanted to like dig a hole and just like hide inside of it and just like be in a little cocoon. So I would say if you can just like play Stardew Valley for like 10 days with like a stack of protein bars next to you and then get up to like, shower and go to the bathroom and stuff. That would probably be the best way to cope with it that I could imagine. Um, yeah, it's just hard. Some of these things are just like stuff that is rough that you just have to wait out and wait for what happens next, knowing that it's going to get better. Yeah, yeah, it's a tough part. Somebody said, are there top surgery options that don't require drains? Yes, there are. My surgeon is someone who I think always does drains. Um, I always assumed I was going to have drains based on what I had heard from other folks about them getting a specific type of top surgery so that they wouldn't have to have drains based on their like breast tissue amount. Um, yeah. I don't know. I think it's like literally different styles of surgery, and I'm not a medical professional. Sorry, I take a shot every time I say I don't know. Just kidding. You would probably pass out. Um, yeah, for me, with the amount of fluid that was coming out of my drains, I would guess that if I hadn't had drains with that same kind of top surgery and incisions and process that they used, that I would have had I don't remember what it's called, but it's when there's essentially, it like creates a cyst because of your lymphatic fluid that is like coming out into the drains. Um, and I've heard that that is really, really bad and hard to have, and like people say worse than having drains. So to me, it kind of just felt like an inevitability. But I think if you have, I know that there are people who have a strong preference to not have drains who like search for a surgeon who does it a different way, based on what access you have to surgeons and your insurance and other things that may or may not be possible. Someone said, is it more expensive or more difficult to explain to doctors if you want a result without nipples? No, not for me. Not for me. Something that is interesting about care for trans people, and not interesting, just like had to have been this way, I guess, is that basically everything that is like a trans surgery or a trans like medical something like intervention, it originally started out as something for cis people, and then they kind of adapted it to be for trans people. um so it is like literally top surgery is a mastectomy. Like it is a gender affirming, chest masculinizing mastectomy, but it's still like, and a mastectomy, if you're not familiar, is what you get to have your breast tissue removed if you have breast cancer. And sometimes folks do it, you know, it because they know that they have like the breast cancer gene and they can just like get that like taken care of, like get as much breast tissue as possible gone. So with like a classic traditional mastectomy, in order to get as much of the breast tissue as possible, there aren't any nipples that are left. So that's kind of like the classic way to have that surgery done. Not, I wouldn't say that it is the most popular by any means for chest masculinizing mastectomies. Um, and I would say also, yeah, it's not the most popular, and it's not the one that they were like doing initially at first. For me personally, the reason that I don't have nipples is because I just didn't want to keep them, and the healing process for them is complicated, and also just like there's a chance that you might still have nipple sensation, and I didn't want any nipple sensation at all. I just wasn't emotionally attached to my nipples, and I was like, I can always like tattoo something there if I feel like it. I don't have any plans for tattoos now, which is what some folks had asked. Um, and then yeah, I just, contrary to popular belief, I am not a trans man. I am transgender and non-binary. The most correct pronoun for me always is going to be they them. I don't mind people using he him pronouns for me at all. I don't say that my pronouns are they he, even though that is probably the most true, because I have found that when you have like a secondary pronoun that other people on the internet aren't seeing other folks use as much, they kind of like glom onto that pronoun, and they're like, oh, this is the one that we should be using. So when I hadn't been on testosterone for as long, and I still had a much higher pitched voice, and I just knew I wasn't presenting as masculinely as I would like to, people were like, it felt like people were seeing me and being like, I bet nobody's using he him pronouns for this guy. I'm gonna he him the shit out of Felix. And so they like went really hard on it, and that was like the opposite of gender affirming for me. I was like, okay, I mean, it felt like they were only doing it because they were like, there's no way people are saying this about you, so I'm gonna be, which isn't anyone's fault. Does that make sense? Yes. So anyway, all this to say, I've never planned on having, like, I'm not gonna look like a cis man, especially with a shirt off. Like, that's whatever. Like, I just wasn't gonna happen. And it wasn't something that I like needed. Maybe if there was a way to get top surgery where there's like no slight additional weirdness for healing with nipples, they're always, what I will say about the healing for nipples, sorry. I have seen a lot of surgery outcomes where people were thrilled with how their nipples looked, and the way that their nipples looked aren't a surgery outcome that I would be happy with. Not that there's anything wrong with them, just that visually it didn't look the way that if I could decide to keep nipples and have them be perfect and just the way that I wanted them. Yeah, I just knew that if I got them, it would be all these things, and also probably something I would like nitpick myself about and be like, oh, like I wish that they were like slightly less this shape or like exactly the same. I don't know. Do you know what I mean? There's just a lot of ways that for me visually, aesthetically, I could possibly be not happy with it. So that was part of it. All of it's part of it. And I didn't want to have nipples. I don't have any regrets about not having nipples at all in the slightest. I guess one, it's not even a regret, but like my nipples like were like really pink. Like they're like a very cute pink color. And I don't have them anymore, and that's fine. And I'm not stressed out about it. And then now also I feel like I have options to like put weird little like googly eyes or like temporary tattoos that say nipple in Comic Sans, like, you know, all kinds of things could be there instead. So I kind of like that it's like a blank canvas. I may eventually get like a chest piece tattoo or something here that wouldn't be nipples. It might be like flowers or like hearts or like something else. But my intention has never been to be like a stealth trans person that people are seeing and being like, that's a cis man. If that happens in my life, then that's fine. Like I'm gonna keep being on testosterone, and I've obviously legally changed my name to Felix. Phoebe doesn't feel like a dead name to me. It feels like an old friend name. Like I don't know. It's not something I really want to have as like a nickname that people call me, but it doesn't bother me that it like was like once a part of me and like I felt like fit me for a period of time and like doesn't really anymore. Yeah. What was the question? Is it more expensive to not have nipples? No. It's more expensive to have nipples with some surgeons and with some it's like more involved because they do like a cut and paste, make smaller, put in the thing. Like a little cookie cutter nipple, put it there. And that is more involved than just having the entire piece of flesh gone, right? So yeah, it's usually cheaper to not have nipples. I have seen, I made a Reddit account finally after all of these years because there's a lot of helpful things on there for like punch needle, like rug tufting guns and also top surgery and like other things. Anyway, it seems that there are some people who had the experience of like their surgeon never told them it was an option to not have nipples. My surgeon is non-binary and uses she, they pronouns. Dr. Tacker up at Legacy Good Samaritan in Portland, who is great. Love them, love their team. They were wonderful. No complaints from me. But yeah, so especially having a surgeon who is non-binary, it didn't feel like I needed to explain to anybody like, here's why I don't want nipples. Nobody asked. Anytime somebody was like, did you want nipples? Which they ask a lot because they have to write it down. And also you can change your mind at any time is what they kept telling me. I would just be like, no. And it didn't feel like it was like a judgment question at all. It was just like, oh, okay, cool. In the same way that they ask like when I was 14, actually, I had a tumor removed from my left breast, and that scar is gone now, which is cuckoo bananas. That was like anyway, that's wild. They cut that scar off, like it's gone, just normally. Not intentionally, it just happened. They kept on being like, which breast has a tumor in it, and I was like, my left breast. And they ask you like a million times, kind of same as they ask your birthday or your name or like other things. So to me, it didn't feel difficult or uncomfortable at all to be like, no, I don't want nipples. I have no interest in having nipples. Somebody said how to cope with fear of change. I would say therapy if you can get it. I'm the kind of person who, if I get a new phone, it like ruins my day for like a full 48 hours to have to like, or like phone updates, like iOS, whatever, make me miserable for like at least 2 hours. So I'm not great at dealing with change. Something that was helpful to me about top surgery recovery is knowing that like it is a period of change that is like gonna be over. Now for me, the change of not having boobs is just like so much more positive. I just like don't have to like think when I'm getting dressed, which is great. Not think about boobs at least. Anyway, you know what I mean. Yeah, I don't know. It depends on how you deal with change, but I would say in general, therapy. Shout out Rosanna. I love my therapist. That same person also said is being under scary / difficult. I had surgery one time previously where I got a tumor removed where I was like completely knocked out with general anesthetic. I don't like it. It's like the part that freaks me out the most. When I was talking to my therapist about it, I think I kind of like came to this moment where I was like, oh, that's why. It is this like, because I'm not afraid of sleeping, right? But like the idea that I've been like forced into sleep and also don't decide when I wake up, it's just like very scary, vulnerable, uncomfortable. It's not good. So I think even if you're getting surgery for a really good reason, nobody likes being put under. It's not comfortable. And also you wake up really disoriented and also like you're anxious the whole time before. And like, yeah, I don't know. I would say it was yeah, it was like probably the scariest part for me was being like, ha ha ha, the actual surgery. Like I'll be getting surgery. But even with that, and with the recovery being so bad, so worth it. So worth it. I would do it like 10 more times. Now, I would be a huge bitch, but I would say very worth it. Somebody said, what was a hobby you felt comfortable doing while in recovery? Audiobooks are really good. Watching TV is really good. I'm more, when I had drains in especially, just had like so the worst attitude that like doing something, it wasn't so much about like the physicality of what I was able to do. They're also, depending on your kind of top surgery, very different requirements put on like movement and other things. For mine, I just wasn't supposed to put my arms up, I think like past my shoulders, I think, for the first, until my first post-op appointment, like a week out, I think. And then I wasn't supposed to sleep on my stomach. I was supposed to sleep on my back or my side once I got my drains out. And yeah, it's just like things, it was hard to like reach and do other things. But they also very emphatically were like, it's important that you brush your teeth. It's important that you like do those like other like care tasks because there's something that you'll like need to keep doing, even though your chest feels tight and it's gonna be a lot slower to do those things. Like don't restrict your movement in that way. So yeah, I would say just because my attitude was so bad, there wasn't a lot of like hobbies that I wanted to work on. And maybe you'll be completely different, but I feel like coloring might be possible depending on your kind of top surgery. Some people, they literally have to keep their arms like kind of like here. Yeah, I don't know. I think it depends on your surgeon and their recommendations and the kind of top surgery. Because I had folks tell me like you're not going to want to do or be able to do literally anything, and that wasn't quite my experience. But my attitude was so bad. Oh, somebody said if you're out of your post-op binder, do shirts like hurt your incisions / scars? Like do scabs catch the fabric? So I don't know what other people experienced, but with mine, I had surgical glue. Squeaky baby. Surgical glue on my incisions that it was like a little bit like sticky, I guess is kind of like the best way to just, it was kind of like, do y'all know those, it's like on like credit cards to stick them to like a piece of mail or something. It's like that little like peely piece of glue. I felt kind of like that, but like covered in lint because I had like bandages and like other things. So if after showering, I had like peeled up a piece of it just a little bit so you could see more of like the sticky part, something got stuck to it that was kind of like uncomfortable or might have like pulled or something like that. But yeah, generally now that I'm out of my, for like a long time now, the like surgical binder, I guess I'll just like show you guys. This is all so numb. And the numbness is like going away a little bit now that I'm so many weeks post-op. It's the 5th. Oh, wow, 2 months. Is that right? I think that's right. I think it's 2 months, which is bananas. But yeah, very, very numb. Very numb. My, after my last post-op appointment, my surgeon was like, because I have dissolvable stitches, they were like, push on these and like rub on them. And you know, you're pushing hard enough if it's like turns white. Sorry, my scars hurt when I push on them really hard. And then they hurt when I have like weird occasional nerve pain from like, I don't know if it's really from moving or like from it. Sometimes it's like if I like reach for something, it'll be uncomfortable, but it's like this weird, like shooting, very short-lived pain. I don't have, anyway, no. After the glue came off, they're like pretty connected and have been, like the two, you know, chunks of flesh or whatever for a hot minute. They've definitely changed. But basically since the surgical glue was off of them, they've just kind of, they're like smooth. It's like not a big deal. It's like very, very numb and weird, and then not comfortable when shoving, but otherwise, no, like shirts aren't uncomfortable. If, you know, I hate to wear something that's wool and scratchy anyway, but probably if I was wearing something scratchy and wool, I would be like, ah, this is really, really weird on my like numbness, coming back from numbness incisions. But yeah. What is kind of uncomfortable to the touch is these stretch marks. I have never had stretch marks show up so quickly. I feel like normally I have stretch marks that happen over time as my body's changing and like other, you know. So if these look like they hurt, it's because they fucking do. They're like, it's not comfortable. And it's just my skin learning how to be skin again after a huge chunk. My incisions go like so far up into my armpits, which is great. That's how it's supposed to be. But that's part of why it's like that. And yeah, just that skin stretching back out in such a short period of time. Like anything touching like up here, it's like tender, I guess is probably the closest word. Just a lot of people asking like, what could they put in a care package for their friend who's having top surgery? Like, what could they do to like help out a friend who's having top surgery or has recently had top surgery? If you're able to go to somebody's house, if you're like close and can help them like set up their stuff so that they can like reach it, like have them walk around their house and pretend to like grab things without moving their arms farther than like this. Not even that. That would be incredible. If you can make freezer meals in small individual, something that they can like easily stick in the microwave, like individual servings. That way it's not like heavy and they have to like scoop out or like move things around. That would be incredible. If you live far away and you can send them like $20 for DoorDash or something. Yeah, I don't know if there's a lot of, in terms of like care package-y type things. If they don't have either a loofah on a stick or like scrub brush type thing, that could be really helpful. Protein bars. Yeah, it was really, really hard to eat for me when I had drains in just because I felt so nasty. So it was a lot of like protein bars and protein shakes and just like whatever sounded good, if anything sounded good. Yeah, a lot of people being like, I'm so scared of the pain of recovery. What was your experience with pain? Like, how did pain feel? It was just so different than I thought that it was going to be. Not unbearable. The discomfort for me was a lot worse than like the pain. And yeah, I think if you had asked me while it was actively happening to me, I would say that the pain was really, really, was really bad. It's the first time I will say I've ever been prescribed a narcotic from a doctor and then not had any of it left over, when I was done, been like, ha ha ha, I need more of that though. You have to give me more or I'm not going to be all right. And it wasn't great, but it was doable. I don't know. It's really, really important to take your medication on a schedule and get ahead of it, because if it creeps up on you, it's just gonna like keep building and get worse. But the like actual like very painful part, I would say was fairly short-lived compared to the ongoing lot of discomfort from like drain sites and other things. So as a therapist here, what would be good for me to know for my clients getting surgery? That's a great question. I don't know. I guess just that like as much as you can express to them, it's a huge change, and it's also something that is really bad before it gets really incredible. So yeah, just like if any feelings there have of frustration or irritation or discomfort or like, oh my God, like this was an absurd choice for me to make, like now I have to like deal with this and like this sucks. Those things are all fairly normal as far as I'm aware. Yeah, the discomfort of having drains was so bad that I, at the time, was like, how is everyone not talking about this? Like, how is anyone who's had drains, how is this not all that we're talking about ever? Because it was so overwhelming. And now, with a lot of space from that experience, I'm like, it's so fine now, you know? Yeah, and just as much and as gently, I guess, as you can say, like, your brain is gonna protect itself and be fine. So even if it feels like so shit right now, like it will be better. People who were almost in the Beatles but didn't end up being in the Beatles don't say that they regret their life choices and that they should have gone back and been in the Beatles, because it's kind of like, well, there's not really anything you could have done. Now we're here, you know? This is what we're doing now, and I like the things I'm doing now, and so here we are. And for me, even more positively than that, like, I feel great. I'm so glad I don't have boobs. When I first saw my chest, I was like, and now I'm like, oh great, that's exactly what I pictured. Like, and also, if it's not exactly what you pictured, or if you continue to have feelings about it, they have like scar revision surgery and lots of other things that can be done. So there's options for you. Somebody said, did your pillow provide enough padding? I'm clumsy and terrified of bumping into things. So real. I have a baby with very kicky baby feet. So I would say the mastectomy pillow, crucial. Crucial. So good. If you have like a cat or a dog or any smallish creature that like steps on you or tries to kick at you, do that. Or if you just run into things. I also run into things a lot. The mastectomy pillow, actually way more than I thought it was going to. Like the side part for my armpits was way more important than like the front part. Partially because for some reason my baby loves to kick my armpits, but also it's just really, really tender here. I think it's partially because like with where the actual incisions are, there's so much numbness. And then up here, because that's not where actual like chopping was happening, there's less numbness, so you can feel more. Yeah, for the mastectomy pillow, like having that like here and on me. I wore it for way longer. I mean, there's not any amount of time you're like supposed to wear the mastectomy pillow. Like it's very like optional. But if you're someone who doesn't have a mastectomy pillow, just putting little pillows underneath you for you to like prop up and like sit and do other things, really good. Really, really. Somebody said, are the scars itchy? They're not now. I would say I had probably like 3 days where they were like itchy and it was not good. And even then it wasn't really on the scars because they were so numb. It was kind of like, it was like my drain sites, really, actually. Yeah. Not too bad though. Oh my God, sorry. Somebody said, where do the boobs go? Do you get to keep them like wisdom's teeth? Like passersby? but wisdom's teeth. And that's my favorite question. I would have loved to keep them like wisdom's teeth. I also couldn't keep my wisdom's teeth, which was so annoying to me. They did take a picture of them, and I think I have the picture somewhere. But yeah, I don't know if it's just depends on what state you're in, but it's like a biohazard to keep most things that they take out of you. I had a tumor removed from my breast when I was 14. They wouldn't let me keep that in a jar either as like a specimen. Yeah, no, I think they just throw them away. Oh, I told them they were allowed to test them for science and also to see if I had breast cancer. I think was what they did. Anyway, I wasn't worried about them. I was like, whatever. Those are gone. Not my problem anymore. Oh, a lot of people asked in comments, not on here, just about being fat and having top surgery. Yeah. I don't know. I am chunky and knew I was going to be before and after top surgery. It was a little bit jarring to see. Just obviously you're a little more like tubularly shaped when you have like big boobs and also big tummy, and then to go from that to like just big tummy, it feels like, the tummy's kind of taking center stage in a way that it hadn't been previously. Immediately post surgery, there's like a lot of bloating that happens. So I think I kind of was like, whoa, what's going on there? And my body looked different. Not that there would be anything bad with having a tummy that was bigger than mine or anything like that. I just was like, I just didn't look like myself, and it felt, in more ways than one, I guess. But yeah, some folks who are, plus size get different kinds of top surgery to kind of like keep a little bit more tissue up here. That wasn't something I was interested in just because I knew, I don't know, I had a fear of my boobs growing back, not like actually, but just like having enough breast tissue left over that they would still give me dysphoria. So I opted for like a flatter version of top surgery. I know some people get like it's kind of like an anchor type shape one that technically counts as a radical reduction, but also for gender affirming reasons. Yeah, and honestly, maybe if I had had a fat surgeon, I would have felt more comfortable asking for that. I don't know. I'm really happy with my results. I know some people think it looks a little bit silly to be so flat up top and then to be like chunky. I'm not worried about it personally. I think any work you can do towards body neutrality, just neutrality at all, for anyone is great, and will help you in life emotionally, because your body's going to keep changing. One thing about bodies is they are never staying the same. They're just not. So yeah, I don't know. For me, it was the part that was jarring about seeing myself post surgery had less to do with my tummy and way more to do with like how bruised I was. And the shape that my like incision was. Yeah. Oh, people also asked if my doctor had a BMI requirement. I don't think so. If she did, she didn't bring it up to me. And someone messaged me because I had been saying no, and then people messaged me. One person messaged me and was like, there is a BMI requirement for this doctor. I couldn't find it anywhere. I didn't look very hard, so it might be easy to find. I also can't remember what my BMI is. I think that's basically it. Thanks so much for being here. Yeah. Thanks so much for being here. If you're getting top surgery, good luck. If you've already had top surgery, slay. If you also don't have nipples or a thing connected in the center, matchies. Love that for us. Cute. And yeah, if you have any questions, if there's enough, I could do like a part 2. And yeah, just thanks so much for being here. We so appreciate you. If this is the kind of content that you'd like to see, we'd love for you to like and subscribe. I say we as if I'm 2 people, but me and my wife, who's not here right now, the baby is sleeping on her. And then we have a Patreon where it's like there are like little like tiers, but you get everything for $1 a month if that's the kind of thing that you're into. You can see us just chat at a camera for like 20 minutes, like once a week-ish. just about whatever's going on. So if you don't think it's boring when to hear us sit and talk, that is something that you could do if you wanted to. And also you get on the close friends story on Instagram. Okay, yeah, thanks. I'm dying. Okay, love you, goodbye now.